So I want to be very clear that people need to understand if they receive their first dose of vaccine, their second dose will be available at the very same provider. They will be able to go back to that provider for their appointment and they will get their second dose. It might be 4 weeks or 5 weeks between doses, and that's completely acceptable up to 6 weeks within CDC guidelines. And for the efficacy of the vaccine, you can get it up to 42 days after the first dose at the same provider they first received it. There is no difference in the medicine that is in the first dose or the second dose.
Right. Which is why that problem came to fruition in the first place. When the state had communicated that the process needed to be sped up overall, and I think that there was a point of reference at some point, it said that there needed to be more vaccines going into the arms of Pennsylvanians at a rate of somewhere around 80%. Do you feel like it was clearly conveyed to providers that dose 2 shouldn't be used for dose 1? I mean, how did we get here? How did that even happen?
No, clearly, as the secretary said this morning, we can do a better job of communicating with providers, and we are starting that this week and holding daily calls with providers to make sure that they are aware of the situation and the fixes that we're putting in place, and reminding them also that the second doses that they have scheduled for their patients, they will get those second doses. They may not get first doses moving forward, as the change was announced on Friday, but they will receive the second doses, and they need to use those for the patients who they gave first doses to.
So do you think the Department of Health shoulders some of the responsibility for maybe not doing this form of communication earlier in the process? And also, how did we not see this coming when we've had 8 months?
Well, the vaccine has not been available for 8 months. We're into week 10 of the vaccine being available. And remember,
I understand that, but we knew it was coming, right? I mean, we could have planned a little bit better.
Well, at the same time that we knew vaccine was coming, we were also fighting a pandemic. In the fall, there was a resurgence in cases across the country, not just in Pennsylvania. So it's the same team that is fighting the pandemic and fighting COVID virus, also then moved into the rollout of the vaccine. So it's only been available for 10 weeks. And in that time, we have continued to improve the processes. And that's part of how we came to the point over the weekend of realizing that a number of things happened that resulted in providers inadvertently using second doses to provide to people first doses, because everybody wanted to get the vaccine out as quickly as possible. And we appreciate that. And we want people to get the vaccine. We need to be careful, though, to ensure that second doses are available. And that's what the secretary said today, is that we are ensuring that everybody who got their first dose will get their second dose at the very same provider. And we're taking care of that. And now we're working more closely with the providers so that they know what's happening.
I mean, I applaud the transparency. Are you saying that the Department of Health needed more help earlier on in order to, foresee these problems coming down the road, that trying to navigate through the pandemic while setting up the vaccine rollout was too much, or that there more help needed to happen earlier on? Is that what you're saying?
Ryan, everybody across the country is fighting the same problem in every state, trying to figure out, fighting the virus on one end, keeping their healthcare workers protected at the same time, and then rolling out the vaccine. So it was a monumental task in every state across the country.
Yeah, and I don't disagree with that, but it seems like we're saying that some of these issues that are happening over this 10-week window, which you've identified, are happening because we didn't have the capacity to look into the future, because we didn't have necessarily the staff or the resources to do it.
Nobody had a crystal ball to look ahead and see where things would happen. We worked as closely as we could with providers and to ensure the second doses were going out to providers. And in some cases, it was not clear enough to the providers of which they should use for first doses and which they should use for their second doses. And we're being more clear about that now. We have better tracking systems in place to be able to keep track of the doses as they're going out. Those are some of the things that, sure, earlier they could have been put in place, but nobody could have foreseen the way this rollout was going to happen.
Is it safe to say that our plan could have been much better going into this 10 weeks ago?
10 weeks ago, we started getting vaccine into arms as soon as it came into Pennsylvania, and that's what people wanted. And that created a demand that was far beyond what the providers and manufacturers of the vaccine were able to manufacture for Pennsylvania and for every other state.
Yeah, and we're still at the bottom half. I think, and I don't know who does this. Independent studies, I guess, say that we're 49th overall in terms of per capita or shots administered of shots received. How do you address that problem? Because for Pennsylvanians, it just seems like it's mismanagement.
That's exactly what the secretary announced on Friday. The order that she announced is specifically intended to get the vaccine out faster. We know that some providers have been slower in putting the information in and reporting the vaccination. So there is some lag there, and we understand that. And again, we're working more closely with the providers to make sure they have the tools and the resources to do the reporting as quickly as possible. And then we can turn around and get the vaccine that we're allotted from the federal government back to them as quickly as possible.
All right, I'll make this my last question, Barry, because I've asked you so many. But what sense does it make to eliminate family doctors from this process and this effort overall, at least in the interim, because it just kind of feels like we're going to be overwhelming our pharmacies, our health centers, and our hospitals? Because right now, at least in central Pennsylvania, we don't even have a mass vaccination site. So it just feels counterintuitive, and it seems like it could disproportionately affect our rural and urban communities who rely on a lot of these primary care physicians.
Well, first of all, Ryan, just a reminder that primary care physicians will continue to get second doses, so that if their patients receive the first dose, their second dose is secure and they can get it at the same provider.
Right, I'm talking about the first
eliminating the same as the first dose, exactly. We're not eliminating the primary care physicians from the vaccine supply chain. Right now, some of them are affiliated with other health systems, and those health systems will have the vaccine coming in and they can get it to their primary care physicians. That's one way that they will continue to get it. And what we have built this infrastructure of providers of vaccine that are local and trusted by individuals, because we know we're planning ahead for the future when there's more vaccine out there and there's some hesitancy of people to get it. We want to continue to have people trusting their local provider and going to those local providers when there's plenty of vaccine available, that they will continue to get it so we can vaccinate as many Pennsylvanians as possible.
Right. And I'm just saying that there are a lot of independent family doctors, though, especially in our rural communities in places like Perry County and Franklin County, where they're not tied to a medical system. So sidelining them, because like you said, you're not eliminating, and I agree with that, sidelining them for 3-4 weeks is going to diminish access in those types of communities where, let's be honest, trust is low based on the political climate of 2020.
That is true, that there will be a temporary sidelining of some of the providers because Pennsylvanians have demanded more vaccine faster. And the way we can do that is by holding the vaccine providers accountable so that when they get vaccine, they have to be committed to deliver that vaccine, 80% of it, within 7 days of receiving it. Some providers have been slower than that at this point because of the nature of the variety of different providers that we have prepared in the system to provide vaccine. All of them will be getting it when more vaccine is available, and it will be available to the people in those regions.
Barry, point of clarity too. Allison Beam had said that they noticed that the problem was noticed in January. Does she just mean looking back, you determined that the problem started in January for dose 1 and the dose 1-2 situation?
Right. Looking back, it looks like it began about 4 weeks ago.
But you just noticed it over the weekend.
Yes.
Okay.